Pablo, it's nice to have you here. And you've had a interesting paper this year at HICSS on technology and public health. And I was wondering if you can tell us a little bit about the research.
Thank you, Bill. Yeah, so in this research, what we are doing is we are combining state-of-the-art image classification techniques and other computer vision algorithms with citizen science. And the goal is to provide a solution for public health emergencies. Our motivation was the outbreak of the Zika virus in 2015 and 2016. So the system that we are developing, we envision that might have uses in the future for these types of emergencies.
So what was the motivation for trying to enlist citizen scientists for the tracking of Zika?
Yeah, so the motivation is that, well, first of all, we want to improve the communication with the affected communities. And the other motivation is that state-of-the-art classification algorithms, image classification algorithms, that is, they require a massive number of images. So having the collaboration of citizen scientists is very important. They help us. They collect images, they send these images to our servers, and this speed up the building of our data sets.
Okay, and what is the sort of technology requirement for a project if it was going to be widely used?
Well, in terms of the technology requirements is citizen scientists, they need to have a smartphone with a camera enabled, which is very common nowadays. In addition to that, there's a small microscope that is attached to the smartphones.
That just clips on?
That clips on,
yeah.
Exactly. And then all the other technology is on our side. So we have all the server that is collecting all these images, and all the computational power is on the other side. So basically, the citizen scientists can start contributing to the project right away. Once they have this application installed in their phones, they can start providing us with images.
Oh. And are there limitations on doing this on a global basis to get where the Zika really is a problem?
Yes, well, we are still facing some limitations. For example, in some countries, the smartphones that are available to the population are sometimes they don't have they still don't have like good cameras maybe, or like so we tested this in Peru, where we noticed that some of the population had the smartphones, but those smartphones were still like in a like the old technology that we used to have. Yes, another limitation would be like having enough experts in this domain that could help us curate the images that we are receiving from citizen scientists. So we know that image classification algorithms, they have a high prediction rate, a very accurate results. But despite of that, we always need to. There are always some images that need some additional confirmation from a human expert.
From experts. Okay.
Exactly. So
and one of the things HICSS is interested in doing is promoting junior researchers. Do you have some advice for technology researchers who might be interested in getting into the classification, image processing, and public health sorts of areas?
My advice would be identify a problem, and this is not very difficult. I mean, read the news, see what problems we are confronting nowadays. And there are many frameworks for image classification that are available right now. So start playing with them, start learning about the techniques from them. There are some frameworks that are very easy to use in a way. You don't need to be an expert in machine learning, you don't need to be an expert in deep learning, but you need to have some basic knowledge of coding, and you can start with that and keep building on top of that.
Okay. Well, thank you very much, Pablo, and we look
Bill.
forward to more papers at future HICSS.
Thank you so much.
Thank you.